Good afternoon. Welcome to another week with me. Welcome to Reading Live with me, Vinod James. Welcome to Neethu's Academy, Reading Live. Hope all of you had a lovely 2 days of absolutely relaxed. Yes, did you? I'm sure that you were all doing a lot of recap on what you have done for the past 1 week. Yes, you would have gone out, all those things. Yes, no. Or as always, were you all so much, uh, pushing yourself and practicing a lot? See, I would always suggest, like I'm not a person who would say do without giving yourself some time to recoup yourself. Please do. Sidhu, good afternoon from Bangalore. So the first person to enter is Sidhu. So tell me, how was your weekend? Did you all enjoy? Or did I overdo on the aspect you all took your own time just to ease off a bit of, calm and soothing time for all of you? Yes. Jilmi, good afternoon. Excellent. So as good, Sidhu saying his weekend was good. Fair enough. So how about all the others? Were you all having a lovely weekend? Because every time the most important thing for us is, whenever we come with a fresh week, there are a lot of exciting news that you would love to let us know as well. Sajeev Soman, good afternoon. This week I have exam. Do not worry. You're absolutely gonna be enthralled after the exam and wait until your result comes. So don't worry. Christina Rose, good afternoon. Nice. So I have this week you have exam, is it? Okay. Fair enough. Right. How about others? What did you do this weekend? Georgie Johnson, good afternoon. So nice to see at least one icon next to your name. All those students who have entered, they always have at least one icon next to. See, you can see a heart shape, you can see a hand waving, you can see a flag, number one. Jaspin Joseph, again, number one. Good afternoon. So nice. That shows that how much of a support that you're all rendering towards Neethu's Academy. As a family, we always are so proud to have all of you as a family members. So no matter wherever you are from, a very good morning, a very good afternoon, and a very good evening to all my lovely students. I'm sure that as what Sidhu was saying, I'm preparing for my exams this week, and there are a lot of students I'm practicing a lot. There are a lot of students I have to balance between my work as well as my personal time, of course. Shine Johnson, good afternoon. Tansy, good afternoon. So if you have not yet subscribed to our channel, please do click the subscribe button. If you have not yet liked the very same page that you're watching, please do click the like button. If you have not yet clicked the follow button, please do click the follow button, because that's the only way where you can show that you're all supporting whatever that we're doing. See, we try to do a lot of things, a lot of things, and there are a lot of things in the pipeline to make sure that you all are reaching without any hindrance to your dream country. Rajani Vinu, good afternoon. Narmada, good afternoon. Nice. Lot of profound names. But of course, is there anybody who's attending this live for the very first time? Please do let me know as well. Rekha Vinayar, good afternoon. Nice. Chinchu Lakshmi, good afternoon. Very good afternoon to all of you. If you have not yet, again I repeat, if you have not yet clicked the like button, if you have not yet clicked the follow button, if you have not yet clicked the subscribe button, please do, because you will never be left empty-handed, because there are a lot of things that is happening with us. So every information will be there in front of you. Update. Okay. So if you think that yes, whatever that we're trying to do is of course beneficial, please do. And I would request all of you to share the very same page that you're watching if you feel my classes are beneficial and it has an impact on you, so that you want to make sure that the others are also getting an impact. Now, why? See, because there are n number of students who are across the globe who have no idea that we are giving these kind of free classes. So if you feel that yes, this is better and it can have an impact on another person's life, please do not hesitate to share the link as well. Jaini Jason, good afternoon. Anita Simon, good afternoon. Soni Sri, good afternoon. Anju Suresh, good afternoon. Apira Sally, good afternoon. Anija Devdattan, good afternoon. Atira Arun, good afternoon. Few new names. So again, I repeat, if you have not told me that you're attending the live for the very first time, please do let me know. And also where you're from, because I love to know where my students are from. And we have just pinned the social media platforms that 𝐻𝐻𝐬𝐧 Academy are there. We have, just to keep you updated, we have one 𝐻𝐻𝐬𝐧 channel, WhatsApp channel. There you have the link. We have 2 Telegram pages. You have the link there. Why we keep on emphasizing? Because there are lots of fraudulent people available. Okay, so you always have to be very wise. Okay, see, there are people who come and say we are from this and we are from that and all. We do not, or we will not message you like that. So if anybody messages you like that, we are telling you, please block them and report them. Safest. Do not even respond. Don't worry about it. Okay, Grishma Devasya, good afternoon. So again, I repeat, there are a lot of things in the pipeline which is going to be of great benefit to you. And ever since 2024, we have been keeping on reminding you the importance of a lot of things, because you wanted reading to come. Again, my colleague is coming with another reading. You wanted listening, our colleagues are coming with listening, our colleagues are coming with speaking. We have grammar. Priyanka. Kavita Balaji, good afternoon. Priyanka, what is your opinion regarding current situation in New Zealand? What is the problem, Priyanka? Tell me. See, generally, Atira, Arun, this week I have exam. Don't worry, Atira. You have all done whatever that you are supposed to do. So do not worry. Trust your instinct. Do practice well. Give the rest to God. Pray well. Everything will be okay. So don't get unwanted stress. This is just another day. You go give your best. Everything will be okay. Jean Bino, good afternoon. Priyanka, if you're asking about nurses and all, see, whom I know who have gone, they're all enjoying their life. So I don't know what you're talking about the current New Zealand situation, because there are lots of things that they have done to make sure that you are benefited, isn't it? Neetu Madam just had a live with regards to some latest updates with regards to New Zealand. If you have not yet watched, see, these are the things. Priyanka, thank you very much for asking also, because whatever that we know, we come on the very same page, we come with all the platforms, whatever that we are. So that is the reason we ask you to like it, so that you don't miss any of these updates. Reshma, good afternoon. So there is not much, I don't know what you're talking about the current situation, but if you're talking about work-wise, there are a lot of changes that have come, which is of course benefiting you, monetary-wise, a lot of things. So please do keep a track of it. And if you are an aspirant to go to New Zealand, there's no other thing that is going to refrain. All right, see, you have to always remember there is no one such place where everything goes smooth, depending on how we take it. Okay, so current situation, as far as if you ask me, all my students who have gone there are happy. I don't know, nobody have told me that, even for all those people who have been there, nobody has told me anything about any issues there. Right? So if you ask me, I'm saying there's no problem at all. All right? Priyanka, you there? I hope you're listening, because I don't see any other. Annie, so nice. Annie is always. See, Annie is another person who have made it to her dream and enjoying the lovely life in Ireland. But in between, she's so grateful. So I have to say, it is an honor to have a student like that. Every now and then comes and says, hi, how are you? Just to have that rapport, which is an absolute honor to say Annie is always there with 𝐻𝐻𝐬𝐧's family. So Annie, I'm doing good. Missing your classes. Thank you very much, Annie. Very sweet of you. And my regards to all of you as well. Whomever that you meet, please do convey our regards, because we always believe that you're all our family members. Bia Maria Benny, good afternoon. I have exams, so I'm so proud that a lot of students are there in front of me who have the exam today. Do not worry. Okay? Whatever that you have infused, whatever that you inculcated, till date, keep on pursuing it. Do write the exam. That is one thing that you have to always remember. Do write the exam with the utmost confidence and do not worry. Please do make sure that do whatever to the best of what you could. Do practice. So you have been practicing, you've been doing a lot of things. Trust me, God will grant you great result. Atira, anybody having exams in Bahrain? There are any number of students who have. So don't worry about all these. Just stick to what is it. Trust your whatever the strategy that you have incorporated. Okay, we'll be talking about it on the coming days. Let that come on the previous day. Yeah. So all the exam takers, welcome. All the people who have made to their dream, welcome. All the people who have been here to go to their dream country, welcome, welcome, welcome. So are you all ready for today's session? Because Priyanka, I still haven't got any reply on the aspect of what is the current situation that you're talking about. Thangasudha, good afternoon. Because if you really look into just after this live, do go back and see. Neeta madam have come up with an update on aspect of what is happening with the New Zealand thing. You know, if you're looking for that, please do refer that. Yeah. If there is anything, if I could, of course, we'll be happy to assist you. Even if I don't know, I'll definitely check with whomever who are the people who are prominent, and I'll get back to you. Okay, there's no way that we will leave you empty-handed. If you want more clarity, there's a number there on the screen. You're always welcome to call them. They will be also able to assist you. Right. So I don't see anybody having any other. See, this is very nice. Okay, I always love when a student communicate. Okay, good enough. Sophia Thomas, good afternoon. So are you all ready for today's session? Yes, if so, give me a quick thumbs up. Let me see how many of you are eagerly waiting for today's session. Yes? No? I hope all of you are ready. Yes? And I know that you're all there with a purpose. What is the purpose? To make sure that I also reach my dream destination. Kavita Balaji is the first one to say ready. Tanga Sudha, ready. Good enough. Atira Sally, ready. Jilmi, ready. Anita Simon, ready. Fair enough. Jean Bino, ready. Radhika, ready. Grishma, ready. Shine Johnson, ready. Sidhu, ready. Reshma, ready. Good enough. Achira, Arun, ready. So as you all said that you're ready, Anju Suresh, ready. So the material will be popping up on the screen, and do not waste your valuable time. Let it be the exam takers, let it be the normal students or the people who have just entered. Doesn't matter. Do find an answer on or before time. Shiny, ready, new name. Narmada ready, Bia ready, Christina ready, Sophia ready, Josna ready, Lijo ready. So please do the material and then we will discuss. Right, time. I've seen a lot of new names, yeah. So Josna, hi. Lijo Thomas, good afternoon. Angelina Mool, new name for me. Josna Prince, ready. Rekha Vinay, ready. Chris Mary Joseph. I'm sorry, Chris Mary George, ready. Nikki Sirik, ready. Soumya Bobbin, hi. So few new names. Is there anybody who's attending the live for the very first time? Please let me know. And how many of you have completed or got an answer on or before time? Simi Thomas, hi. Sorry, ready. Anybody have got an answer on or before time? Yes. Nobody have got an answer on or before time. Yes. Did you? You did. Sidhu done. Okay, fair enough. Shine Johnson done. Excellent. Anita, yes. Okay. Ashwati Vijayan, good afternoon. Grishma done. Okay, fair enough. Fancy done. Athira done. Sophia done. Angelina done. Okay. Josna done. Angasudha done. Radhika done. Shine Johnson done. Neetu Unnikrishnan done. Kavita done. Okay. So good. Now you are there within the system, isn't it? Now you have to talk. Because the only way that I would know is from your valid fields. Narmada done, Bia done, Rekha done. Okay, good enough. Now, would you be kind enough to tell me what is your answer and where you got that answer from? Not just what is your answer, where you have got that answer from. Ashwati done, Soumya Bobbin done. Okay, fair enough. Please do let me know what is your answer and where you got that answer from. That where is very important. Why? Because, see, you have to know. We need to know where you have got it. See, come what may. Right answer, wrong answer. It's not a problem. Abida. Okay, fair enough. Good afternoon. Thank you for your support by giving the Route Foundation for reading. Your support will be absolutely excellent, Abida. Abida, I saw your what do you call your winners meet as well. So very happy to see that you have made it to your dream, Abida, and coming and telling so much appreciated, because you have been that catalyst, isn't it? Because if all the people who have seen you, they would know how much of an effort that you have put. So Abida, it is not me, it is your hard work that have made you get that. So absolutely good enough, Abida. Very sweet of you to come and tell. And when I saw your picture there, I was very happy to know that you have made to your dream. So Abida have made to her dream. So congratulations on behalf of all of us from Neetu's family. Grishma Devasya B last line, Anita B last line, Ashwati Mol good afternoon, Tanga Sudha B, Shine Johnson C, Anija C, Josna B, Athira B, Angelina C. So it is a thing between B and C now. Good enough. Am I happy? At least you're all saying. Usually what happens when somebody says one answer, the others doesn't say. But happy that you are all sticking to your answers. Kavita B, Shiny C, middle, Tansy B, last para, Christina Rose C. Good enough. So please do let me know what are your answers. Do not worry if you have got any other answers as well, because there are times, as I've always mentioned with my student, all of you have got it right. One of 99 have got it right. 50-50, 75-25, the other way around also. So it's not something, okay. So Rekha B from last line, Reshma A last line, Bia C last line, Neetu Unnikrishnan C middle. See, now this is where that diversity happened. The same answer, the same area, 3 different answers are a possibility. It is possible, depending on how we analyze it. Okay, so this is where that thing goes. See, part B is about gist. You have to understand the gist about it. Okay, it will always be there in a paraphrase form. So don't think that paraphrasing and synonyms are the same. Paraphrasing is different, synonyms are different. Okay, so because I think that Whoever have to tell the answers I've told, I know that not all of you have told me, but again, I will take it. So the material will be popping up back on the screen and then we will be discussing. So what are the things that you have to be very, very, very cautious about? 3 important things that you have to do in part B is 1, read the question. As soon as, or as you read, you're going to underline the keywords in the question. And keywords should not exceed more than 3 words, depending on the question. Okay, if it's a lengthier question, can be. But generally, most of the questions are very much on the aspect of 2 to 3 keywords. Elimination is the most appropriate option and which I believe. Okay, so after underlining, you have to understand the question. Very, very, very important. So, what is the most appropriate action when a treatment has no prospect? Okay, so no prospect. That is enough for me. So most important thing to do when there is no prospect of a positive. When something is not going to be worth enough or it is not going to happen, what is the most important thing? So read. Has no prospect of, what is it? A balance must be achieved between burden and benefit? Or is it talking about patient should be transferred to another doctor? Family should be counseled. Okay. Now, if there is no use of, or if there is no much of a thing on the aspect of positive development, what are you to do? Okay. Or what is the most important action? Is it going to have a balance between the burden and the benefit? Or is it going to be transferred to another doctor when you think about there is no benefit? Or it should be, the family member should be counseled. So, futile treatments. In the circumstance that no evidence show that a specific treatment desired by patient will provide any medical benefit, the physician is not ethically obliged to provide such treatment. So what are they saying? Generally, they are giving you a hint saying that, see, if the patient is not going to be having any benefit, the physician is not obliged to give any treatment. Why? Because there is no use. Now, the physician need not provide any effort at the resuscitation that cannot conceivably restore circulation and breathing. So the physician know that there is no point of giving a resuscitation and there is no effect in the patient, it's not needed. Okay, but he or she should help the family to understand and accept this reality. So what is that? If there is no benefit, the family should be taken care of, is what they are saying. So slowly or slightly pointing into C. Let's read. The more common and much more difficult circumstance occur when treatment offers some small prospect of benefit at a great burden or suffering, but the patient or family nevertheless decides it. Okay, that is when there is a small prospective about it. Okay, our questioners have no prospect. Okay, if the physician and patient, appropriate surrogate, cannot agree on the aspect of, you are not able to see the screen, is it? I hope it will be okay now. Right. So if the physician and patient or appropriate surrogate cannot agree on how to proceed, there is no easy automatic solution. Okay. So they are saying if they don't know what to do and all those things, then there is no easy solution or automatic solution. Consultation with learned colleagues or an ethic consultation may be helpful in ascertaining. Ascertain means to find out, definitely, to cement it, to confirm it. Okay, this is a very beautiful word. You can use it in a lot of places. Ascertain what interventions have reasonable balance of burden and benefit. So this is not about no prospectives or no prospecting. See, when things are not, they don't know what to decide, then they can do this. So option A is a straight eliminator. Now, timely transfer of care to another clinician who is willing to pursue the patient's preference may resolve the problem. Okay. Now the question is what? When there is no prospectives of positive result, Most appropriate. Most appropriate. Now, where are they saying when there is a small prospectus? So what is this? See, to more common and much more difficult circumstances occur when the treatment offers small prospect. So all these things are, the confusion is happening when, if there is no prospects or some prospects. So this is where you go wrong. Understood? You're literally not giving the importance of these kind of keywords in the question. No prospect. This is the most important aspect. See, there are two things which is mentioned in the paragraph. One is about no prospects and what happens if there is a slight possibility. And here again, if you really look into the sentence structure, kindly transfer of care to another clinician who is willing. Okay, you can transfer. Patient's preference may resolve the problem. What is the problem? Because they can't decide onto it. Understood? So B is not, the patient should be transferred to another doctor is not the most appropriate thing. The family should be counseled. When things doesn't happen, you have to counsel. So congratulations to all the people who have got C. If you have any doubts, you're always welcome to clarify. Any doubts? Grishma, do not cry. That is why we are here, isn't it? See, our job is as a trainer is to make sure that you all look into those kind of important things. Sidhu, clear? Fair enough. Mega Charles, after some time, good afternoon. Adira, clear? Fair enough. Kavita Balaji, understood. This is why I told you paraphrasing. See, what you do, you literally look into the keywords. Okay, consultation. This one, may resolve the problem. No, you have to understand the question. Okay, Neetu Unnikrishnan clear, Anita Simon clear, Shine Johnson is happy. Fair enough. Tangasudha clear. Good enough, good enough. So that is why I told you all the three answers are a possibility. I'm not saying no. You have to always be cautious with that. Very seldom you get one thing you can easily eliminate or two things you can easily eliminate. But most of the time, all the answers are possible if you don't understand the question properly. GNB no clear, Tangasudha clear. Okay, fair enough. Because I don't see any doubts coming in. So if you don't have any doubts, can we go to the next one? What is the next one? Part A. So what is today's part A? It is 𝐴𝐿 syndrome. So I've told you what is today's material. I want you to tell me how was the material and how many minutes it took for you to complete. Because that minute is also something which I take a note on, because we've been emphasizing the importance of doing it in 8 minutes. We've been emphasizing the importance of getting 20 out of 20. We've been emphasizing the importance of getting 40. Mega Charles, part A. Yes. 𝐴𝐿 syndrome. So, how you felt about today's material and how many minutes you took in order to complete. Tangasudha, easy 13 minutes, okay, good enough. Sidhu, easy 14 minutes, okay. Easy material, 13 minutes and 20 seconds, good enough. Jameel, you are the best. Thank you very much, Jameel. I wouldn't agree on that because there are many prominent people. Okay, so it's very sweet of you because you say that, because that is your heart, which is a great thing. So I take it as an honor, because you have seen a lot of people. So thank you very much for that. Yeah. Jilmi, tricky 13 minutes. Okay, fair enough. Atira 12 minutes. Shine Johnson, easy 13 minutes. Mega 13 minutes. Josna 13 minutes. Easy. Grishma, easy. I took 11 minutes and 4. Fair enough. Good enough, Grishma. Neetu Unnikrishnan 13 minutes. Kavita 11 minutes. Very easy. Absolutely good enough. Jean Bino, easy 14 minutes. Okay, fair enough. So because you have all given me a rough figure, let's go and dig it. I'm going to fire the 20 answers. You're going to tick and tell me how many marks you've got. Yeah. So the material will be popping up on this. And you have to always remember, see, each part has its own importance. Each part has its own strategy. You have to always remember what is the purpose. So part B, I told you, it is about paraphrased answers. Part A, I'm going to rephrase it. It is not going to be paraphrased answers. You're going to refer the keywords. keywords are of key importance in finding answers in part A, because we don't need to input a lot of our knowledge into it. Where are those keywords mentioned? From there, you'll find the answers. Okay, there you have the material. So what are the things that you have to really be cautious about? First and the foremost important, how much time? This is the most important factor. 15 minutes. How many questions? 20 questions. What is the strategy? Strategy is called skimming and scanning. I keep on reminding, and we have discussed a lot of times what is scanning. Scanning means detailed look. Skimming means quick look. And I told you what are the keywords that you have to underline. How much time can we take? What are the differences that we have? We will have 4 texts based on one common theme, and today's common theme is 𝐴𝐿 syndrome. So 4 texts, text A, text B, text C, text D. So each text has its own difference. So you should know what are the difference. So what do? You skim. So skimming, generally they say 1 to 2 minutes, but I would say take 15 seconds per text. It's more than enough. If you can quick read it. Quick read is the skill there. Okay, you have to go through it very quickly. See, for example, 𝐴𝐿 syndrome is also known as 𝐼𝐿 syndrome. Is a genetic condition that affects your liver. They are the next part. The condition of liver abnormalities. People born with 𝐼𝐿 have distant physical characteristics. The condition of other people life-threatening. 𝐼𝐿 syndrome is genetic and passes from parents to children, and only one parent needs to pass the gene to the child and experience autosomal dominant. And because 30 to 50% of cases are affected in the same diagnosis, some cases occur no history of affected gene in the family history. Sporadically, 𝐼𝐿 syndrome affected about 1 in 30,000 to 45,000 people, and this is because it's underdiagnosed or misdiagnosed in severe. Done. So what I know, 1 in 30,000 to 40,000, 30 to 50%. So what are they saying? It is a genetic condition. It is passed from one gene to. Okay, done. Likewise, quickly go through. So this is talking about symptoms. Do you need any other clue? Any symptom with regards to 𝐴𝐿 syndrome, go there. So there is some classification in here. So something about child is mentioned. Okay. Now, any other thing mentioned? Likewise, symptoms, then liver damage, all those things are mentioned. So it is there, abnormality. Then suspected diagnosis. So anything about a diagnosis, which is about a study there. Now, text D is about treatment. So I know what are the difference of each text. Now go to questions. So 20 questions divided into 3 types. Okay, you have to know these 3 types. You have to know the instruction by heart. You are not supposed to waste your valid time underlining or reading it over and over again. So what are they saying? Question number 1 to 7. These type of questions are called match the following questions. So 1 to 7, you should know what the instruction saying. Letters you have to write A, B, C, D. And you may use any of these letters more than once. So underlining keywords are of very, very, very much of an importance. You have to do that. So when secondary diagnostic approach is warranted by evaluating ALGS. So do you really need to have a second thought? Diagnostic approach, I just told you where diagnosis is mentioned. See, understood? See, if you can differentiate, okay, these are the answers, these are where my answers are, okay, these are my texts, you can easily, 1 to 7 is a piece of cake. See, occurrence rate of 𝐴𝐿, see, 1 in 30,000. Where is it? A. This is from where my primary indicators of liver damage. So where are they talking about all these symptoms? Symptoms in B. Understood? Strategies employed to optimize nutrient absorption in infants. So strategies employed. So where are they going to talk about? It should be under treatment? Should be. D. If you want, I'll show you. See, it is not something that you... So drinking formula with medium chain cycle, the better nutrients absorption in infants. Done. Understood? So you don't need to waste time is what I'm talking about. What is the source of 𝐴𝐿 syndrome? So source means where? It is there in A. What are the? So where are they? They are saying 𝐴𝐿 genetic when passes. So these are the reasons. So A. Okay, because I don't want you to get confused where it is. So that's why I'm sure. So pharmacological agents prescribed for alleviating pruritic symptoms. So what is this pruritic symptoms? You are all medical professionals. Tell me, what is pruritic symptom? Sorry. Pruritic means what? Let me see if there is anybody who is. Because when I found that word, I got so much interest and then I went and searched. So what is pruritics? Tell me. Let me see how many of you say. Very good, Grishma. 𝐻𝐿. That's it. See, these are called synonyms. Very good. So where are they talking about 𝐻𝐿? Only one place. Even if you don't know, where are they talking about treatment? Pharmacological agent means treatment. D. Good enough, Atira. So common cardiac anomalies frequently noticed in patients with 𝐴𝐿 syndrome. So very specifically talking about heart. So where are they talking about? Symptoms. B. Now if you want, where are they talking about? Do you really want to know what are they? Where are they talking? See, they are clearly mentioning, saying 𝐴𝐿 syndrome can affect your heart and how it's functioning, including they are giving you few reasons. Understood? I don't know, Neetu Nikrishnan also saying 𝐻𝐿. So the next set, Sidhu 7 out of 7, absolutely good enough. 8 to 14, Josna is saying 𝐻𝐿. These type of questions are called short answer questions. Jean Bino 7, excellent. Atira Arun 7, absolutely stunning. Keep it up, keep it up. Very, very good. So 8 to 14, the instruction you have to always by heart it. It can be a word, a short phrase. Now a short phrase should not exceed more than 2 to 3 words. Jilmi 7, Anita 7, Shine 7, absolutely good enough, good enough. Reshma 7, and it can be a words or numbers or both. Ivira 7, Josna 7, good, good, good. Keep it up. Kavita dancing, excellent. Keep it up. Anisha 7, very, very good. Kavita Balaji 7, very good. Keep it up. Now let's go to question number 8. What is a surgical procedure commonly performed to reroute bile flow between liver and the gastrointestinal tract? So definitely they are asking you about a surgical intervention. So where is the surgical intervention? Definitely D. Isn't it? So now bile. Chris Mary George 7. Fair enough. Now where are they talking about this? Is it? Next question. Okay. Now see, surgery to redirect bile between liver and gastrointestinal. What is that? Partial biliary diversion. So PARTIAL BILIARY DIVERSION. Straight answer. Good enough. So what percentage range do cases occur when a child inherits 𝐴𝐿 syndrome from a parent within the same diagnosis? So they're definitely asking you percentage range. So where are they talking about the percentage range and all? Yes, it is there. So the answer should be 30 to 50%. You are not supposed to write between, because between is already there and the question has range. So the range means where is the starting and the end. So 30 to 50. So 30% to 50%. That percent should be written. So I'm just going to write it to make sure that there is no confusion. The answer is only right if you write like this only. Without a percentage sign, your answer is wrong, because the question is percentage. If you write without percentage, that symbol, that only shows as it is incomplete. It's only a number. Fair enough. After an unsuccessful confirmation of JAG1 present, what gene testing should be pursued? Go to C. Isn't it? Now, JAG1 unsuccessful, negative, so something should be pursued. Done. So what is it? Notch 2 is the answer. Here it is saying consider testing notch 2, NOTCH2. What dietary addition enhances absorption of infant formula, optimal nutrient uptakes? You already have done that, isn't it? You have already gone with that reference keywords. So what is that? Drinking formula with medium chain triglycerides is the answer. So medium chain is a hyphenated word. So please ensure that you're writing it with hyphen. Medium hyphen chain triglycerides. Excellent. By what alternative name is 𝐴𝐿 syndrome recognized? So go to first. It is 𝐴𝐿-Watson. Syndrome is not needed because syndrome is already there in the question. So 𝐴𝐿-Watson, hyphenated word. Good enough. Who is the prime candidate for assessment, genetic counseling and genetic testing? So go to C again. So genetic counseling, genetic testing. Who was the prime candidate? Relatives. RELATIVES. Excellent. I don't want to blow your ears off. Yeah, sorry. What cardiac anomaly? So something which is an issue of the heart. Yeah. Often associated with 𝐼𝐼𝐧 syndrome is characterized by septal defect between two lower chambers of heart. So definitely they are asking you very, very, very specific things. So symptom, isn't it? So where are they talking about all these symptoms? So two lower chamber is there. Abnormality is there. So what is that? It is ventricular septal defect. Okay. So it is 𝐕�ＥNTRICULAR SEPTALGEFECT. Okay. So see, it is, the answer should be, because septal defect is there. I was just waiting for you to write. You're not quick enough to tell me. I was about to say, see, the answer should be what? The answer should be only ventricular. VENTRICULAR. Okay. Now, final set of questions. So which is fill in the blanks, which starts from 15 to 20. Instruction remains the very same as the short answer question. A word, short phrase, and everything remains the same. Here, redundancy should be always looked into. If you write the same word over and over again, your answer will be marked wrong. A word, an article. Okay. Dash in 𝐼𝐼𝐧 syndrome disrupt the flow of blood between the heart and lungs, exerting influence into circulatory dynamics. So where are they talking about all these keywords? Symptom again, isn't it? So where are they saying? Where are they saying? Problem with blood flow between your heart and lungs and all is where? Pulmonary artery stenosis. PULMONARY ARTERYSTENOSIS is the answer. In an, now see an. Okay, after an, I've already told you the next word should definitely be a vowel sounded word. Condition symptom manifest when only one parent transmit gene to child. So one parent transmit, where are they talking about? So only one parent needs to pass the gene to the child and child experience symptom, and it is called autosomal dominant. AUTOSOMALDOMINANT. Now see Now after definitely a consonant sounded word. A dash facilitates the recipient of nutrient directly into the stomach. So something where the nutrient is fed directly into the stomach. Go to D. So where are they saying? Receiving nutrient from a feeding tube into your stomach is gastrostomy tube. So the other one through your nose to your stomach. So not direct. So gastrostomy tube. GASTROSTOMY tube. When ALGS diagnosis diverges from dash but displays specific features, assessing the presence of JAG1 becomes imperative. So where are they talking about these? Go to, so where are they saying it is imperative? So this becomes imperative when it is talking about what? Does not meet or meet. Anyway, it is the same thing. Classic criteria, isn't it? So CLASSICCRITERIA. In infancy or early childhood, 𝐼𝐼𝐧 syndrome may manifest, yet its dash persists undetected until adulthood. So where are they talking about? Very straight answer. Symptoms of 𝐼𝐼𝐧 noticeable in infancy. All the other keywords are as such. So symptoms. The ultimate question. Antihistamine, cholestyramine, naltrexone. naltrexone and dash in conjunction with moisturizers or lotions constitute pharmacotherapeutic regimen employed in alleviating itching symptoms. So where are they talking about? Definitely in D. Yes or no? Is it in D? Of course, it should be there in D only. So antihistamine, all those things. So what are those? Using moisturizers and all those things are there. So what is it? There is only one thing which is missing is rifampin. RIFAMPIN. So I have wrapped my 20 answers. If you have any doubts, you're always welcome to. Monica, hi, good afternoon. Reshma is the first one to tell me, yes, I got 18. Fair enough. How about others? If you have any doubt, please do clarify. If not, do shoot. Ivira 18. Excellent, excellent. Keep it up, keep it up. Sidhu 18. Very good, very good. Keep it up. Good enough, good enough. Any doubts with regards to part A, please do clarify. Some institutions are saying it in 1 to 7 in last 5 minutes. You are saying it in written order. Official OET says the same. What method? See, Jamesh, please do understand. I would always advise you, whatever you feel it is better, please do. Okay. See, I've always believed a person who always believe what the right source is saying. Okay. See, each student have their own different perspectives. Okay. So please look into, if you feel that doing from the other one is what is going to benefit you, please do. Okay. There's no hard and fast rule of like that. As long as we finish our answers, 20 answers in that given 15 minutes of time, come what may, you have the right to choose your strategy. Okay, if you are a student who have done like from what the other institute have, so and you have already done that into a system, isn't it? Do underline the keywords and all and refer with the keywords. Come with as what? Let's say you're starting with 20 and down, doesn't matter. Because I always believe 1 to 7 is more easy. Why? Because it's only asking you to say which text, isn't it? Because I really don't understand what is the significance of that. But you know, when a trainer does that, maybe they would have found it from certain ways and depending on certain students. So obviously what you do is you take what is benefiting you and stick to it. Okay? Shine Johnson 18, Josna 17, Rekha 17. Good enough, okay. Fair enough, Monica. Please do check your answers. Shine, thank you. So as Shine, I've already started saying thank you. And I don't think that there is any other doubts which you want me to clarify. So until and unless I see you all tomorrow, adios from me. God bless you all. Take care. Bye.